Gina. I'm one of the physical therapists here and clinical specialists that works with Aspen Aftercare. So we are here with our patient, Gina, as well. And she just completed her 30-day home program after coming to us and doing the fast track. So Gina was diagnosed with right breast cancer in August of 2022. She had a bilateral mastectomy and reconstruction with implants above the muscle on November 2nd, 2022. And then Gina, do you just want to tell them what happened when you first noticed some symptoms of capsular contracture?
Yeah, when I first noticed, it was definitely obvious. I went to my doctor. Doctor said that it was capsular contracture. He offered to either do another surgery to replace the implants or do a tummy tuck and do smaller implants. And I wasn't for it. So I did some research. I found that there's different options like Aspen ultrasound, the different treatments that you guys can do, totally reverse capsular contracture, which is great.
You came to us in February. We had done a virtual evaluation to do an assessment and make sure that you had capsular contraction, that you'll be a good candidate from the program. And at that time, you just had the capsular contracture on the right or the left side, sorry, correct?
Mm-hmm.
So you came and did the fast track, meaning Gina was here for 5 days. She's seen Monday through Friday, twice a day, where we did the treatment. And at the time of the first eval, the left side was slightly higher than the right side and was a grade 3. And on her last visit, she was level, both at the top and the bottom, and was a grade 1 for compression testing. Mm-hmm. So Gina, tell them a little bit, any tidbits, your experience being here for the week, anything that would be helpful to anyone watching this, going through the same thing?
Well, it was helpful to know that you could be a little bit rougher with your boobs. It wasn't pain. I wouldn't say it was painful. It was just, it wasn't painful. It was just, I don't know what you should use.
You feel like pressure when we were doing the mobilizations?
Oh, absolutely. There's definitely a lot of pressure, but I could tell by the first day there was starting to be a difference. Like you notice almost every day the difference. And I find myself wanting to compress them now to make it feel better. Mm-hmm. After it's just like stretching. It's just like stretching. So it's like after a while, it's actually not that bad.
And after the 30 days, what percentage of improvement, 0 to 100%, would you say for softness of your left breast?
Oh, 90.
Okay, perfect. and for the positioning, nice and level still after your 30 days? Okay, perfect. So anything else you want to add for anyone watching?
It's worth it. It's worth it better than having another surgery. Absolutely. Unless you like to go under and have surgery a million times, then I would recommend it. I think every doctor, my plastic surgeon was he's like, how did you find out about that place? I said, well, I researched, and he wasn't I figured he wasn't very happy that I found you because he didn't get to cut me open again. But I think everybody should I think it should be more broadcasted with cancer. It's with the bilateral mastectomy. I think it's a huge difference for women. Totally.
Yeah, great. The benefits are there is no downtime that you would have post-surgical. It is obviously non-invasive. So besides being here, for 5 days for treatment and doing a home exercise program, you can pretty much live your normal life, no restrictions. And we do have a 90% success rate. So Gina's just one of those patients who just did really well. And the virtual eval again helps us determine if people are a good candidate before coming down here. And so if people are interested, whether you've had just a regular breast augmentation or revision, or you've had a mastectomy, if you're questioning if you have a capsular contracture, if you're questioning if our treatment would be appropriate for you, the easy thing to do is just call this number, reach out to us, and we can schedule a virtual evaluation and see if Aspen would be the right choice for you. So thank you, Gina, for sharing your thoughts, and we're so glad you did so well. Yes, we're both Ginas. It's very easy for us. But thank you guys so much for listening. Again, you can call us if you have any questions or if you'd like to schedule a virtual eval.